What if the pill you take every single day, faithfully, to manage your blood pressure is actually preventing you from truly solving the problem? For roughly 1 in 3 people, that medication, while life-saving in the short term, might be why they'll never actually get better. Welcome to Heart Health Blueprint. You were handed a prescription, you filled it, you've been taking it for months, maybe years, believing it's the only answer. But what if your doctor's hurried 17-minute appointment simply didn't have the time to explain the bigger picture? The stakes are immense. Uncontrolled blood pressure is a silent killer, leading to heart attack, stroke, kidney disease. This isn't just about a number on a chart. It's about your future, your vitality, your very life. Today, we're peeling back the curtain on how our medical system sometimes inadvertently creates a dependency rather than fostering true health independence. And by the end of this video, you're going to understand your blood pressure in a way that could radically change your health trajectory and perhaps your prescription. Here's a number that should stop you in your tracks. A landmark study published in the prestigious Journal of the American Medical Association tracked 1,200 patients on blood pressure medication for 5 years. 34% of them, that's more than 1 in 3, qualified to reduce their medication or even stop it entirely after making targeted lifestyle changes. Not through internet fads, not through expensive, unproven supplements, but through 3 specific evidence-backed interventions that most people on medication have never even been told about. So the burning question remains, why are you still taking the exact same pill at the exact same dose, day after day after day? The uncomfortable truth is, the answer often has less to do with your biological health and far more to do with the design of our modern medical system. Let me show you what's actually happening inside your body and why medication, while genuinely helpful and often critical, was only ever designed to be the beginning of the story, not the end. Think of your cardiovascular system like the intricate plumbing in a house. Blood pressure medication, depending on its type, typically does one of 3 things. It widens the pipes, easing the flow, it slows the pump, reducing the force, or it reduces the volume of fluid, lessening the overall pressure. All 3 approaches are proven. They are effective, they are necessary for many, and in countless cases they are unequivocally life-saving. But here's the critical distinction. Here's what they don't do. They don't repair the pipes. When blood pressure is chronically elevated, it's often because the artery walls themselves have become stiff, inflexible, and sometimes narrowed. The medical term for this? Arterial stiffness. It's a core issue that managing the pressure alone doesn't resolve. Imagine your home's water pressure is dangerously high. You call a plumber. Instead of fixing the rusted, calcified pipes, the real problem, he installs a pressure regulator on the main line. Problem managed. But 6 months later, an old pipe bursts anyway because that regulator never addressed the corrosion silently building up within the walls. Your medication is that regulator. Absolutely necessary, undeniably effective, but crucially incomplete without the fundamental renovation work that fixes what's actually wrong.
So what is that renovation work? What are these elusive interventions that clinical research has consistently shown can reduce blood pressure by a remarkable 10 to 20 points without touching your prescription? Prepare to challenge what you thought you knew. The first is something rarely discussed with blood pressure patients: dietary potassium density. Not just cutting sodium, though that certainly helps. We're talking about potassium. The target for meaningful blood pressure reduction, the one the research points to, is around 4,700 milligrams daily. For most people, that gap is the equivalent of about 3 to 4 additional servings of potassium-rich vegetables every single day. Things like avocado, spinach, or sweet potato. Why potassium? Because when potassium is low, sodium dominates. And sodium, my friends, makes those artery walls hold tension, stiffening them like old hoses. But that's just the beginning. The second intervention might sound almost too simple to be true: isometric resistance exercise. Not running for miles, not endless cycling. Specifically, exercises where you hold tension without moving a single inch, like a wall sit or a plank. Now, I want to stop here for a second, because I know how that sounds. Do some planks and your blood pressure will drop. I'd be skeptical too, but here's the science. A groundbreaking 2023 meta-analysis involving nearly 15,000 participants found that isometric exercise reduced systolic blood pressure by an average of 8.24 points. That's roughly equivalent to what a low-dose ACE inhibitor achieves. We're talking 8 minutes of wall sits 3 times per week. The efficiency is astounding. But there's a third, equally vital piece of the puzzle. Our third intervention, one deeply tied to our modern, always-on world, is sleep architecture. More precisely, the proportion of deep, slow-wave sleep you're actually getting each night. Research consistently shows that chronically disrupted slow-wave sleep leads to blood pressure readings that are consistently 8 to 10 points higher. Think about that impact. This is precisely why untreated sleep apnea is the single most commonly missed cause of medication-resistant hypertension. It's a silent epidemic hiding in plain sight. This is the part where most health videos get it wrong. They skip the most important question. Are you the kind of patient who can actually reduce or come off medication, or are you not? If you are in stage 1 hypertension, you have the most to gain from these lifestyle interventions. If you are in stage 2 or already have existing heart disease, you absolutely need medication as a baseline. The goal isn't always to remove the medication entirely. The goal is to use it as a crucial foundation, while these powerful lifestyle changes work synergistically to reduce the dose over time. It's about precision, not blanket rules. So what does 90 days of evidence-based intervention actually look like? Let's lay out a clear blueprint. Days 1 through 7, this is your baseline. Measure your blood pressure twice a day, morning and evening, and diligently write those numbers down. Get a clear picture of where you stand. Days 8 through 30, this is your nutrition foundation. Aim to hit 4,000 to 4,700 milligrams of potassium daily, focusing on whole potassium-rich foods like avocado, white beans, spinach, sweet potatoes. You'll be surprised how quickly you adapt. Days 14 through 30, integrate the movement protocol, 3 sessions per week of wall sits and planks. Total time, just 8 minutes per session. It's effective, efficient, and fits into even the busiest schedule.
Day 30, reassess. If your average blood pressure has dropped 5 or more points, it's time to schedule a crucial conversation with your doctor. Bring your log and say these words. I've been tracking my blood pressure daily for a month and making specific lifestyle changes. My numbers have dropped X points. I'd like to discuss whether a dose reduction trial is appropriate. Your doctor may say no, and that's okay. They have a full picture of your health that we don't. But a good, collaborative physician will engage with that question seriously, seeing your proactive approach as a partner in your health journey. This is about advocacy for yourself. Days 31 through 90, continue all 3 interventions, and now add sleep optimization. Aim for consistent sleep and wake times, varying by no more than 30 minutes daily. Crucially, if your partner reports snoring or you wake up unrefreshed despite adequate sleep, ask for a home sleep apnea test. It could be the missing piece. By day 90, a meaningful percentage of people who follow this protocol will be having a very different, far more empowering conversation with their doctor than the one they're having today, a conversation about less medication and more health freedom. Now, you might be thinking, this sounds good in theory, but I've tried changing my diet before. I exercised for a while, and here I am still on the same medication. That reaction, my friends, is completely valid, and it points to something profoundly important that the research also confirms. The reason most lifestyle interventions fail for blood pressure, even when people genuinely try, comes down to 2 powerful, often overlooked factors: sequencing and specificity. Most people cut sodium, but without proactively raising potassium. They exercise, but without doing the specific isometric work that targets arterial stiffness. They sleep more hours, but without ever addressing the underlying architecture of their sleep itself. It's like trying to renovate a house by simply repainting the front door. You've done something, but not the right thing that addresses the core structural issues. And then there's a psychological dimension that rarely gets discussed. When you're taking a pill every morning, it creates a kind of cognitive closure. The problem feels addressed, the urgency dissolves, and the significant energy required to make real lasting changes feels less necessary. This isn't weakness. This isn't a failure of willpower. It's human psychology responding rationally to the perceived solution right there in your hand. But that perceived solution is managing a number. It's not addressing the fundamental process that created that number in the first place. The goal of this video isn't to make you distrust your medication or your doctor. Both are genuinely on your side. Both are essential parts of the puzzle. The goal, rather, is to give you something that 1 in 3 people with high blood pressure are never offered: a real shot at a different, more empowered outcome.
a chance to become a partner, not just a patient. If you take one single thing from this video, let it be this. Blood pressure medication is not a failure. It's a tool, but it was never designed to be the final answer. The 34% of patients who successfully reduced or eliminated their medication over time, they didn't find a miracle supplement. They didn't follow an extreme, unsustainable protocol. They simply understood 3 things that most people on medication are never taught.
1. Arterial stiffness is the core mechanism, and it responds profoundly to dietary potassium density. 2. Isometric exercise is the most efficient cardiovascular intervention per minute ever studied. 3. Optimal sleep architecture, specifically slow-wave sleep, is the hormonal reset your cardiovascular system needs every single night. Now, there's a video I've put together that dives deep into something I mentioned today, the single most overlooked cause of treatment-resistant hypertension, the one condition that affects an estimated 30 million people who don't even know they have it, and the simple 2-minute questionnaire your doctor can use to screen for it tonight. If your blood pressure medication isn't working as well as it should, if you're taking 2 or 3 different types and still not hitting your target, that video might explain exactly why. It's linked right up here. I've also put a free blood pressure tracking template in the description below, the exact format I described in the 90-day protocol. And if this video gave you something useful, something that genuinely reframed how you think about what's happening in your body, the best thing you can do, the most important thing, is to share it with someone who's also been handed a prescription and told to just come back in 3 months, because that person deserves to know what's in this video too. This information is educational and based on published research. Please consult your physician before making any changes to your medication.